So welcome back in the part 2 video of history taking. In the part 1 we have discussed from history taking points from chief complaint to the history of present illness, and from now from point 3 we will move on further from past medical history. So what is the past medical history and why it is important? Past medical history is very important. For example, in one patient who is having a new illness, or he was previously healthy, now presented with some complaints. So in that situation, it means that what disease we are dealing with or we are going to treat is probably a acute or subacute illness. But in the case where the patient is having previous medical history, having a chronic medical history of diabetes, hypertension, or any previous history of hospitalization, history of trauma, blood transfusion. So this is sometimes usually what happens, that patient is taking medicine for his old illness and the past medical history, and sometimes the patient having past medical history coming to the acute presentation may have worsening of his disease illness, number one. Number two, it can complicate the management of the present illness or present diagnosis coupled with his pre-existing illness. What happens? What does it mean? For example, a patient, known patient of a diabetes, she is a diabetic for long years, for 10 years, now coming presented with fever, cough, shortness of breath. On chest X-ray, we find that there is a patch, so it is a pneumonia. But a pneumonia in a normal patient and pneumonia in a diabetic patient is, the behavior of pneumonia may change. Sometimes etiology may also change, and the patient response to the treatment may also change, because the long-standing diabetes is a pre-existing risk factor for immunosuppression. So we can say that we should always inquire, we should always encounter, we should always know past medical history. The important point in past medical history that we should ask about: history of rheumatic fever, history of any trauma, injury, history of tuberculosis, history of contact of person having tuberculosis or any contagious disease, any history of malaria, kala-azar, jaundice, sexual transmitted diseases like gonorrhea, syphilis, AIDS, any history of exposure to STDs, any illness which demanded blood transfusion, for example, any accident or any operation, systemic hypertension, diabetes mellitus. So this is the past medical history, and actually all the points, all the history is very important and somehow relevant to his present complaint sometime, that we have just discussed. So this is very important to know the past medical history about his childhood illness. For example, any eruptive fever, fever with rash, any other major medical or psychiatric illness in the past, or any history of past hospital admissions. We should always ask about his past travel or maybe recent travel in the disease prone area, especially where we can see in the COVID-19 we have seen that it is a disease that was spread by the travel to the affected area. And also in India also we know that some diseases are endemic in some part of states. So we should always ask from where the patient has come from, or any history of recent travel is present or not. In pediatric age group, we should always take a birth history, proper birth history, that on birth asphyxia patient, I mean the baby when it was delivered, he was asphyxiated or not, was there birth asphyxia present or not. History of immunization, means the baby received proper immunization as per protocol. And is there a history of any injury, umbilical sepsis or meningitis, that this history you can ask from the patient. Sometimes few clinicians prefer to mention hypertension, diabetes, and mellitus within personal history. Some physicians also prefer this, so we can add hypertension and diabetes with personal history. This is very important. Never comment past history, nothing significant. Rather than, we should always say that there is no history suggestive of tuberculosis, jaundice, and so on, any medical history plus minus medical. So we should think, or we should say that important past medical history related to the patient presenting complaint should be inquired, and that should be written here, like there is no history suggestive of tuberculosis, jaundice, malaria, history of blood transfusion, or rheumatic fever. So we should always write in this format. So now coming to the personal history. Personal history is This includes history of the patient, his family members, spouse, and children only. Following points, personal details and lifestyle should be noted carefully. What comes in personal history? It is number one, marital status of the patient or the marital status. Is he married or unmarried? Or with the number of children, how many kids he or may have, he or she is having. Number two, what is occupation? Nature and environment of job and education and employment. Actually, occupational history, especially in the some specialties, for example, like pulmonary medicine, who are having a chest complaint, shortness of breath for pretty long time. This occupation history may change or may have a separate heading with the full description regarding the nature of job, how long he was duty hours, and what was the nature of job, what is field work, what the exposure to the dust, exposure to cotton, exposure to silica, was it a mining job? So this occupation history we can make a separate actually a separate diagram for this, or you can make a separate entity that we can discuss in the detail depending on the patient to patient and specialty wise. But for now, for the undergraduate level, for the just learning, we can add personal occupational history in his personal history. Income, we can ask him directly, or we can also assess socio-economic status. Dietary habit, we can all should always ask for, because whether he's a vegetarian diet, is non-vegetarian diet, so that we can assess about the diagnosis of A vitaminosis. Sometime we know vitamin B12 has a vitamin B12 is a vitamin that is of animal source origin. So strictly vegetarians will have a deficiency of vitamin B12. We can also assess malnutrition in that, and for obesity. History of contraception is very important. Are they using any contraceptive measures or not? And whether they are exercising properly. History of exercise. Do they have a regular exercise? Do they go for walk? Do they have a regular exercise and healthy lifestyle? History of high risk behavior like IV abuse. Is he a drug abuser or have a multiple unprotected sexual exposures, multiple sexual partners, and history of homosexuality. This is very important in hepatitis B or C infection, AIDS, and subbacterial bacterial endocarditis. So this is very important to know about the high risk behavior. And what about his eighth point is domestic and marital relationship. What is his hobbies and any pets at the home? Because we know that some pets have a propensity to cause, or they can transmit some disease like we can say pigeons. Pigeons can cause psittacosis, and it can also cause hypersensitive pneumonitis in the lungs. That patient may present with the cough, shortness of breath, having acute to subacute presentation. So this is very important to know any pets is there or not. And tobacco abuse, history of tobacco abuse, that from cigarette or bidi, its quantity and duration of exposure we should always note for. Now again, tobacco abuse, cigarette and bidi, this thing, any addiction should be ideally have a separate heading, and it should be taken in detail. So I just have made a separate point for addiction history. Addiction history is very important for some particular diseases like COPD, chronic uh, obstructive pulmonary diseases, and history of alcohol is very important in case of chronic liver diseases. So in that situation, addiction history is very important, and we can make a separate point for that to take the history in detail. So we should always ask for addiction of tea, coffee, smoking, alcoholism, or any substance abuse like chewing tobacco, cannabis, or heroin. Pack year calculation is very important in case of smoker. What is pack year? Pack year is number of years the patient has smoked and number of packs he has smoked. For example, a patient is taking 2 packs of cigarette for 20 years. So his pack year will be 2 multiplied by 20 is 40 pack year. So pack year is very important to number to calculate in case of smokers, because pack year has a direct relationship with the development of lung cancers and yes, chronic obstructive pulmonary diseases. So pack year we should calculate in the smokers. Coming to the family history is very important because some diseases run in the family. We all know sometimes there are diseases which have a tendency to run in family, have a genetic predisposition also. So we should always ask a detailed family history for the presenting symptoms of the patient. What does it include? This includes the parents, brother, sister, uncle, maternal or paternal, nephew, etc. Any family history of tuberculosis, because the patient may be affected by the contact, history of diabetes mellitus, systemic hypertension, ischemic heart disease, bronchial asthma, eczema, hemophilia, thalassemia, schizophrenia within the family should always be inquired for. And history of similar type of illness. For example, if this is very important point, for example, if the patient is having any presentation, you should ask that this type of illness the patient is suffering from now, has anyone in his family have suffered the same symptoms? So what this information will give us is, if this information will give us there's something is a common trigger that is causing the problem for both of the patient and his family members. In case of death, number 4 point, if there is any death in the family members, there should always be mentioned why, what was the cause of death. History of consanguineous marriage, that is marriage within the close family relative, should also be recorded, because autosomal recessive disorders like homocystinuria, who have the diseases having autosomal recessive inheritance, they can they may result from the consanguineous marriage. Point 6 is family history is very important in case of hereditary and communicable disease like mumps, measles and chickenpox. Environmental factors should always be taken into account, like effect of passive smoking in a woman who is having a heavy smoker husband. Usually in India, the cause of COPD in women is the passive smoking, because usually the woman does not smoke here in India, but what happens, their husband, they are heavy smokers, they make the environment, they smoke in the house and ultimately giving a exposure of high nicotine to the family members and her and his wife. So women COPD in the women India is because of the passive smoking most of the cases. Lastly, in case of genetic diseases, we should always make a pedigree chart. Pedigree chart is used especially in the genetic disorders where we can have a this is a round and a square shape. The round is coordinated for normal female and the square is for male. So in this way we can make a shadow, half shadow, and we denote autosomal resistance or maybe disease male. So in this way we make a pedigree chart, especially in case of genetic diseases. So coming to the point, 6 point we have covered so far is family history, addiction history, personal history, and past medical history. So this is very important. We have discussed so far, and now in the next part 3, I will try to cover treatment history and history related to thereafter accordingly. So this is very important to know. I want to stress here the important factor that past medical history should always be noted. Past medical history, especially what is should the bare minimum. The past medical history we should know for 2-3 reasons. Number one, the patient may have worsening of his pre-existing disease illness. For example, a patient of known patient having an acute myocardial infarction suffered previous cardiac event in the past, and he was treated for his acute myocardial infarction having a poor ejection fraction, left ventricular dysfunction. Now coming to the worsening of shortness of breath, he is saying that I am having effort intolerance, I am unable to walk, I am having very shortness of breath, and my shortness of breath is increasing. I have a pedal swelling. So what does it mean? It means that the patient initial cardiac condition, that is a congestive heart failure, is worsening. So there is a worsening of previous past medical history. So normal, what sometimes it's written in the Harrison also that sometimes the disease presentation or some presentation of a patient is worsening of his pre-existing disease illness. So we should always look for past medical history. And number two, we have discussed if the patient is having chronic past medical history and having a new illness, for example, an infection, any pneumonias, any new illness. So compounding effect is the patient prognosis may change, patient response to that disease may change, and the sometimes microbial flora, the cause can also be different. So that's also very important. We have discussed 2-3 important points. So in the past medical history, we should always ask for history of diabetes, history of hypertension, history of chronic kidney disease, history of any acute coronary events, history of cardiac event, history of any CVAs, history of tuberculosis, history of jaundice, history of malaria, any history of trauma or blood transfusion. Plus, we should always look for any past history of any prolonged medical illness. That this is a very important point we should always ask for. And if there is any history in past medical record, that we should put down, we should note down in the details. Fine. So thank you. So we will have discussed so far. And now in the part 3, I will try to finish up and make the video complete. So thank you so much and share among your friends and the students who are involved in the clinical medicine, and this will help him to history taking. If you have any suggestion, any doubt, any query, if you want to know, or if you want to put some your feedback, you can put in the comment box. Any question also, that I will try to make a video on that also, and to make the topic as simple as possible. Fine. Thank you so much. See you in the next videos.